Welcome back. It's still Inside Nigeria. Yesterday, October 10, 2021, was World Mental Health Day, which is celebrated across the world as an annual event. And of course, it's aimed at educating people and spreading awareness about the importance of mental health and how one should never neglect their mental health issue. The theme for the 2021 celebration was mental health in an unequal world. Mental health in an unequal world. And of course, joining us this morning to look at the World Mental Health Day 2021 as it affects Nigeria is Dr. Dayaba Shaibu, Clinical Director, Oliesta Recovery and Wellbeing Center here in Abuja, and Dr. Maria Teresa Salihu, Clinical Psychologist at the same Oliesta Recovery and Wellbeing Center in Abuja. Good morning. Welcome, Dr. Dayaba and Dr. Maria.
Good morning.
Good morning. Good morning.
Good morning. It's nice to have you on our breakfast show Inside Nigeria this morning.
It's a pleasure. The pleasure is mine.
All right, let me start with you, Dr. Dayaba Shaibu. The theme for the year, mental health in an unequal world. I'll bring up to speed. Can you elaborate on this theme?
Okay, thank you very much. As we all know, the world is very, unequal. To sound at the risk of sounding very cliche, it's becoming more and more polarized, by the minute. With the rich getting richer, the poor getting poorer. People access to mental health care, is one of the aspects of our lives, that suffers, right? So the educated, have more awareness. The uneducated have less awareness about these things in terms of, belief, affordability, accessibility, to mental health care. So that's the inequality that this year's World Mental Health seems to, kind of normalize, like to bridge the gap of the inequality, to ensure that mental health care is affordable and accessible to more people. So some people need it, but they don't even know it's affordable. Some people know it's affordable, it's available, but cannot afford it. Do you understand? So that's the inequality. So some people tell you that mental health care is for the rich, is a problem of the rich. You hear people say things like, is when you have food to eat that you can start talking about depression. So the question is that the case? Is it true? So the world is really unequal in all ramifications, just like our fingers, people's level of awareness, knowledge, purchasing power are different. So that's the inequality, we're talking about.
Yes, so when do you begin to notice when somebody has mental illness? What symptoms does the person present with?
Okay, yeah. So with mental illnesses, the symptoms are different. So depending on the type of mental illness, right? But generally speaking, when we talk about illnesses, we know that it's something that is a deviation from the norm. So just like with physical illnesses, when someone has a temperature above 36.6 degrees, Celsius, we say the person has a fever, right? Because a norm has to have been established, right? So when we talk about mental health, that is the state of stability or well-being of the way we feel, the way we interact, the way we relate, the way we speak, and the way we think, and relate to the environment. So illness is when there's a distortion in these ramifications. So it differs from one person to the other, but as a general rule, this deviation has to be inconsistent with the person's environmental, social, spiritual, and cultural norms. And the reason why, this is so is such that people don't use their opinions, to label people as having a form of mental illness. So I give an example. If it is my culture to move around dressed in leaves around my waist, for example, the fact that I go to another community and dress like that does not necessarily mean I have a mental illness, because it's in keeping with my belief, my cultural norm. So someone, before you can now say, oh, Dr. D has a mental illness, you have to find out, where is she from? You have to get, you have to get collateral information to say, is this how she dresses normally? Is this in keeping with her social, societal, cultural, and religious beliefs? And then people say that is how we behave, that's how our culture is. Then you have to ask other questions, right? So there are various types of mental illnesses, from the mood disorders to the psychotic disorders to the anxiety disorders. So each of these things have various symptoms. So it will be difficult to say these are the things that we will notice and we say that someone has a mental illness. But I'll give a few examples. The commonest mental illness around the world is a mood disorder, depression. And for some reason, people use this word because it's the most acceptable term for even those of us that believe there's something called mental illness, right? So depression is mistaken for sadness. Oh, I'm depressed. Depressed doesn't mean, I'm sad because I lost my phone. I'm sad because I got scolded at work, right? So with depression, is a state of persistent sadness. So persistent low mood that is present most part of the day, every day, for at least 2 weeks. So it has to be persistent, associated with loss of interest in activities I previously used to enjoy, withdrawal to self, so I keep to myself, I socialize less, right? I either sleep too much or I'm unable to sleep, or I start to eat more or I lose my appetite, right? There's a feeling of hopelessness, feeling of worthlessness, low energy, and in extreme situations, suicidal thoughts. So I tend to start feeling like, I'm better off dead than alive. So, these are some of the symptoms we look out for, in people that, are exhibiting symptoms of depression. So I use depression, as an example because it's a form of mental illness, right? And the psychotic illness, which is the one that people use as the face of mental illness. So the average man or woman roaming the streets, right? Which is what people see once you talk mental illness. The one that picks stuff from the garbage, talks to himself or herself, roams inappropriately dressed. Those are people that have a form of psychotic illness. So there's an illness called schizophrenia, right? So in this situation, in this illness, people tend to hear voices that are actually not there. So when they respond to those voices that are in their head, we see them talking to themselves. So sometimes they're having conversations with people you and I can't see. Sometimes they feel things on their body that are not there. We call them auditory hallucinations. Tactile hallucinations, when they feel things that are actually not there. When they hear things that you and I can't hear, we call them auditory hallucinations. Some of them see things that are not there, visual hallucinations, right? In some cases, we have the gustatory hallucinations where they taste things that are actually not there, or olfactory hallucinations where they smell things that are not there. So not to bore, our viewers, and, there are lots of, there are different categories of this schizophrenia. So there's the disorganized, where they behave, in a disorganized fashion. There's the hebephrenic, where they behave, age inappropriate, picking things from the garbage, roaming the street, But the commonest form of schizophrenia is the paranoid schizophrenia. So they're suspicious. So they feel people want to harm them. They sometimes feel like, oh, there are cameras watching them. Sometimes they feel their loved ones are after their lives. Sometimes they feel their food has been poisoned. So they're paranoid, right? And that's why sometimes you see them walking around and looking around, and they tend to act on the voices they hear. That's why you see people say, oh, this person has a mental illness and can harm me. So sometimes the voices in their head is actually telling them that person coming is about to hit you. Before the person hits you, hit her. So it's a response to the voice they're hearing. In some situations, they are commands. In some situations, there are derogatory statements that the voices keep telling them. So they start to feel, a certain way about themselves. Right. So these are some of the symptoms. But, we have what we call the diagnostic criteria. So it's like a diagnostic manual. If someone complains to us and says, oh, I feel a certain way. So you go through the symptoms and the complaints the person has, to see which of the criteria the person meets before you give a diagnosis. Because we're very mindful of giving a label because of the nature of mental health, mental illnesses. I hope this helps.
All right. Thank you, Dr. Daiba. Let me go back to Dr. Maria. Dr. Maria, I know you're following us because we lost your connection earlier. Now, let me ask you
Morning.
all right, good. You're welcome back.
Welcome back.
Let me ask you a question that look like putting the cart before the horse, because we already asked Dr. Dayaba about the symptoms. So let me now go back to the first thing that ought to be, which is the causes. I know the causes are grouped into two, biological and psychological. Now, can you unpack this for us for the benefit of our listeners?
Okay, so when we talk about the biological factors, you can see factors like, so you can say it's hereditary, sometimes it also has to do with genetics. So some sort of genetical, combination in the person. So that could be biological factors. Then you can also look at psychological or sociological or environmental factors. So say, for instance, you could have two people lose a loved one and they will react in different ways. So someone can maybe deal with it and just move on, while another person can go down and be depressed and will probably need treatment. Sometimes they will need hospitalization. So again, the most important thing is to understand that everyone deals with stress and everyone deals with their issues differently. So the main fact you have, and that's why, in our field, you don't tell somebody, oh, I know what you're going through, because you really don't know, because everyone has different ways whereby they deal with their issues. So yes, you see, especially today, a lot of people will have, for instance, like schizophrenia. Some people could have a family history of schizophrenia, whereby they've had a mother, they've had a mom, sister, an aunt, dealing with that illness. And just one little thing may happen to them, and that will trigger, an episode. So you have some people have their first episode, even, because normally the onset of schizophrenia is from teenagehood. So we're looking at probably from about 14, 15. But you can have some people still have their first episode in their 30s, and you wonder why. So it's important for us to understand that while you have hereditary factors of mental illnesses, you also have environmental factors. You also have psychological factors. You also have drug induced. So when we say drug induced, what do we mean? Some people use substance, some people are addicted to some sort of psychoactive substances. And those substances could actually trigger, psychosis. Those substances could actually be the onset of a mental illness, So while you have the biological factors, some people pick it up just along the way. That's why it's important for us to understand, some of these things that could cause mental illnesses and if they're avoidable. Because at the end of the day, it's important to understand that it may not be curable, but it's treatable. So with good treatment, somebody that has schizophrenia, even the man roaming the streets, with proper and good treatment, they could be able to function, and still fulfill their life potentials.
All right, Dr. Maria, stay with us. Let me still ask you another question about statistics, because I know over time we have been told 10 in every 10 Nigerians are suffering from mental health disorders, and this could translate to about between 20 to 30% of the total population. As a practitioner, you see this every day, you attend to them. What is the actual figure? What is the actual figure, and what is responsible for that?
Okay, I will put a label on a figure because, again, we see different age range. So you can see people 10-year-old, you can see 12-year-old, you can see 40-year-old, you can see 50-year-old. I know about 2 years ago, WHO did say in Nigeria we had about 14 million people. So imagine 14
Yes.
million of us out of our population, dealing with mental illness. So we have that number of people, and I'm sure that was 2019. This is 2020.
Yes, it was.
Last year was 2020, where we had COVID-19 that hits the world very hard. So I'm sure that number did increase. Then we have 2021. Because I remember last year, even during the COVID season, as much as we couldn't do, in-person therapy sessions, we went into virtual, and we actually did see a number of people that were just trying to cope with dealing with the issues that come up, in COVID-19. So that number has grown probably from 2019, from 14 million. I'm sure we have a number of them. But even as a facility, on a daily basis, we see people, from depression. Dr. Shaibu was talking about, what depression is, the difference between depression and sadness in itself. So we see people from depression, anxiety, schizophrenia, couple therapy, different, aspects of psychological needs. That's what we see. And the good thing is people are becoming more aware. Before, people don't want to see a therapist, or you tell somebody, oh, go and see a psychiatrist. They say the word MAD that we don't like to use. I'm not that. I'm not this. Why should I see a psychiatrist? But people are becoming more open. People are realizing that they need to get professional support, because it's different from an advice. For instance, if somebody is depressed, you can't say, stop being depressed, get out of being depressed. No, because they are helpless. They are struggling to come out of it. So with professional help and good psychological intervention, they'll be able to deal with these issues they're going through, and function well in life.
Okay.
All right, Dr. Maria, thank you. Let's go back to Dr. Dayaba. Dr. Dayaba, earlier at the beginning, I asked you to give us more meaning to the theme for the year. Now, it has been reported by between 75 to 95% of people suffering mental health in low and middle income countries like Nigeria find it difficult to access healthcare services. So what can we do to change the narrative? I know this is also happening in Nigeria. There are issues with the archaic laws in place, that has no regard to what is the reality now about mental health disorder. So what can we do to change the narrative?
Okay, thank you very much. So first of all is to look at the allocation to the mental health sector, to the health sector in the first place, right? And out of the allocation, to the health sector, the percentage that is actually allocated to mental health. First of all, for a country that has a population of over 200 million people, I think we have 8 federal neuropsychiatric hospitals, right? So we're talking about accessibility or availability, first of all. Talking about the statistics, let's try to compare this with the statistics, Maria just gave us. For depression, which is the commonest form of mental health in any part of the world, the statistic is that 1 out of every 4 people, 1 out of every 4 people will have, is expected to have a depressive episode in the course of their lifetime. So it means in Nigeria, if we're 200 million people, the thinking is that 50 million of these 200 people will, have depression at some point in their lives. We have 8 federal neuropsychiatric hospitals. How many psychiatrists do we have? How many psychologists do we have, in the entire nation that will cater to the mental health needs of these people? That is availability. The truth is, a large population of Nigerians that are willing to access mental health care do not even have faith in the public facilities. Some of these people, go there because that's all they know. Some of those people go there because that's all they can afford. But the truth is, it's one of the reasons, people don't want to, associate themselves with mental health and mental health care because of the way it is, the way, mental health care is perceived. Back to our role as mental health care providers. How much do we uphold the dignity of human beings in mental health? Because it's said that, sometimes the mental health care providers are, one of the highest stigmatizers of their patients. So there's a role of government in terms of, making sure this service is available. There's a role of the healthcare provider in terms of upholding human dignity. There's the role of family and the loved ones, in supporting the people struggling with a form of mental illness or the other. What you see is, a large proportion of people tell you is a spiritual problem. Yes, it's a thin line between psychiatry and spirituality, isn't it? But I always say, why don't we allow science, play its part to the limit to which science has provided for? Because even if I have malaria, there's still a spiritual component to it. When I'm shivering on my bed and my loved ones feel like, will she survive? They still go on their knees and pray. Oh God, heal her. Oh God, heal her. Let her get better. Let her, we don't want her to die. So why don't we get these people to go into treatment while we seek spiritual help and support? Isn't it? So that's what we're talking about, the inequality. So we say, oh no, I want to go spiritual first before I seek help. Do you understand? So now back to the mental health facilities. The private facilities now are considered expensive. And I ask, what does expensive mean? We all have a choice. We know that there are people that will still, choose the public health facilities over private facilities, not because they prefer it, but because that's all they can afford. So we ask ourselves the question, is the quality of care the same? There are people that would prefer to see a gynecologist, for example, in a teaching hospital because they believe, is a fuller team, right? I have plenty options. I have a robust team to look at my case and give me the best. So is it possible to also have a private facility that has that? Or is it going to cost the same? So these are the inequalities that we're looking at. Some of us have to choose, not because that's our preference, but because that's either what's available or that's all I can afford. So the truth is, there needs to be a lot of work. We need to come back, from the highest level in this country to see how significantly does mental health contribute to our overall health? Why do we push it to the background? Because the truth is, every aspect of health has a mental health component. Remember, I said at the beginning that mental health, has to do with how we feel, how we relate with people around us, how we relate with our environment. So someone is going in for treatment. Let's say, oh, I have this back pain. There's a component of worry. I don't know what they're going to even find. I'm going for an MRI. I'm going for a CT scan. What if I go now and they tell me I have, disc prolapse? That's my emotion. That's mental health, isn't it? So you find physical health hospitals that will tell you, no, we don't have a mental health department because we don't want to have to deal with mental health issues. Why? So there's a lot of work to be done, in terms of working, together. But several sectors have to come together, public, private, because every sector has a role to play, right? And, that's one of the things, we try to do, work with families, interact with governments, parastatals, government organizations and institutions, and see how everyone can contribute. Yeah, government has the facilities. Private sector has, the extra, the extra oomph, to make people accept mental health, the way it should be, not the way it is. Thank
Dr.
you.
Daiba, I need to cut you short because of want of time. We just have 1 or 2 minutes to round up this program. There is a question from one of our listeners addressed to you, Dr. Daiba. You will answer that. Then the final question will go to Dr. Maria. Then we round up with the final question for both of you. So my co-anchor Winifred will read the question for you, Dr.
Okay.
Daiba.
Dr. Dayaba, are you listening? He said,
Yes, ma'am.
Adebayo, Dr. Shraibu, what is your take on soaring cost of medications for mental health conditions in Nigeria, which is posing a major challenge to the treatment of mental health conditions in Nigeria?
I think she partly addressed
Okay, I
that
think
when
she
she was
addressed
talking
it.
about
Yes, the challenges.
accessibility to mental health services being
Yes.
very expensive. Dr. Daiba, I will come to you for the final question meant for both of you and Dr. Maria. But let me go to Dr. Maria, a psychologist. Dr. Maria, there seems to be a
Yes.
trend, teenagers committing suicide all the time. What will you say is responsible for this? And what's the way out?
So I guess again the thing is a lot of young people, they call them the Generation Z, so a lot of young people these days, the social media, there's a lot of influence. I remembered I did go to a program where a teenager did say she thinks suicide is bravery, and that hit me so hard because a lot of them are modeling behavior. So someone takes their life and they think that's bravery. So I think the most important thing is, a lot of more awareness to these young people, for schools to actually have a curriculum. I remember while we were in schools, we had a counselor, but that's different. You just go to your counselor if you're struggling with schoolwork. But these days, you see a lot of young people, a lot of parents realizing that their kids actually need psychological help or psychological evaluation. So I think it's key and important for schools to promote, positive mental health and make it open so that any child that is undergoing any sort of, psychological breakdown can access these services, not just necessarily having a guidance and counseling unit, but making sure it's active, and making sure that professionals are also invited to be able to speak to these young ones, to be able to deal with the issues they're going through. Thank you.
Thank you so much.
All right, finally, both Dr. Maria and Dr. Dayaba, I picked something from you, very shocking that some person consider suicide as bravery. And when Dr. Dayaba was speaking earlier too, she also, made a point that we're living in denial. We are living in denial of our mental health issues. We don't want to acknowledge all those things exist around us. And now COVID-19 came in 2020. The reality is staring us in the face. People, breadwinners lost their jobs. Family losing loved ones. And, it has led to a lot of things, depression and the rest of them. So finally, for both of you, COVID-19 seems to be with us and it has come to stay, probably, like malaria. So how do we know our bounds? How do we get out of depression? How do we save ourselves from mental health disorder? This for both of you in 30 seconds. Let me start with Dr. Dayaba.
Okay, thank you very much. So I would just say basically looking out for ourselves. We should know that there's no health without mental health. Practicing self-care. We should be mindful of the different dimensions of wellness, which, we owe ourselves to nurture. So from the physical to the mental, to the environmental, to the social, cognitive, spiritual wellness. We need to harness these different dimensions, to take care of ourselves, right? We owe ourselves responsibility, to take care of our body. Make sure we, eat right, exercise, maintain our social connections, maintain spiritual well-being, feed our minds with positivity rather than negativity. So thank you. That's just what I'm going to say, overall, so I don't take so much time.
All right, stay with us. Dr. Maria, your concluding thoughts.
Yeah, just like Dr. Shaibo has said, so I think no one should be left without help. It's important for even our primary healthcare hospitals knowing what mental health first aid is. So if someone goes in there and they say I have a headache, there should be some sort of little screening that can be done to actually see, if there are other issues that are coming up and they could be referred to a specialist. So no one should be left without help. Social network, when lockdown happened, a lot of people were able to bond and connect with their families. I think that should be ongoing, whether it be via media, whatever means. Let's make sure that we have positive connections around us. Thank you.
All right, many thanks to both of you. Dr. Dayaba Saliu, Clinical Director at your Leicester Recovery and Wellbeing Center here in Abuja, and Dr. Maria Teresa Salihu, Clinical Psychologist at the same Leicester Recovery and Wellbeing Center here in Abuja. We hope to see more of you here at the Leadership Podcast Studio on our show Inside Nigeria.
Thank you.
Thank you so
Thank you
much.
very much.
All right.
Thank you
Thank
for
you so
having
much.
us.
Bye-bye.
All right, at this point, we need to allow you to go attend to your patients. Many thanks for joining us this morning. Winifred, it has been a wonderful discussion this morning.
Very,
and it is
and
time
so
to
enlightening.
go.
But do you know that I got enlightened today?
Honestly,
used to hear,
we
oh, I'm
live
so
in denial.
depressed. Maybe I lost my phone. I used to, oh, I'm so depressed.
That's mental health.
Yeah.
And a very, very critical aspect of our well-being and health. Many thanks to Dr. Dayaba and Dr. Maria this morning. Well, from here at the Leadership Podcast Studio, make it with us tomorrow for another edition of Inside Nigeria. From I am Winifred. Bye for now.